Hello everybody, I'm Dr. Nandini Ray. I'm a senior consultant ophthalmic surgeon and I've been practicing at Fortis Medical Centre ever since I arrived here in Calcutta from the UK in 1996. Speaking with over 3 decades of experience on cataract and cataract surgery, I'm asked quite a few sort of relevant questions regarding the subject of cataract. And one of the commonest questions that I'm asked is, what is a cataract? What are the symptoms of a cataract, causes of a cataract, and when to see a doctor? I mean, these are all very important questions, and I have a model of a human eye to make it much more simpler for people to understand. So if this is a human eye, we're all born with a crystal clear intraocular, it's a lens. We're born with it and it's usually clear, but what happens with aging, there is a change in the nature of the proteins and it slowly loses its clarity. It becomes opaque in varying degrees. Now, when there is an opacity of that lens, which was previously clear, it can become like an early cortical cataract. So you can imagine when you have this early cortical cataract sitting in what used to be an absolutely clear human lens, obviously your visual clarity is going to decrease slowly and surely. There is very rarely something called a sudden loss of vision with a cataract. If it is sudden, it's usually a patient has realized it suddenly because probably the vision in the second eye or the contralateral eye was very good or was good. And sometimes we have even adult patients saying they've, closed one eye accidentally and they've suddenly realized that they can't see. So the symptoms varies in the sense that it could be a gradual loss of vision. The patients can say that there's halos and glare around bright lights. A type of cataract called a posterior subcapsular cataract, which is a cataract in only one aspect. The patients can say that my vision tends to get worse when I step outdoors in bright sunlight. If it is an ordinary nuclear sclerotic cataract, the patient says, I need more light, just the opposite of a posterior subcapsular cataract. They actually say, I need more light, doctor, to see, to be able to read. I'm finding things dull. A white shirt is appearing cream. A red tomato has lost its color. It's no longer the brightness of colors is lacking. So there are many, many symptoms, but usually sudden loss of vision does not happen, which is more likely to be a hemorrhage or a retinal detachment. There are various causes of cataract. The commonest cause of cataract is it's like an age-related change. What I tell my patients, it's a normal aging change. If it happens in some people who are much younger, I often ask, did your parents get cataract surgery when they were young? And, more often than not, they say, yes, oh, now that you ask me, my mother got a cataract surgery age 50, and my father got surgery done, he said, when he was, in his late 40s. And that is a young age, and that does tend to happen in families. Apart from like a physiological normal aging change, what are the causes of cataract? It could be traumatic, it could be steroid-induced, it could be radiation-induced, it could be associated with certain medicines as well. But more often than not, we can see cataracts in certain diabetic patients, uncontrolled diabetes, where the patient has not come back for a normal routine checkup. High sugar levels can certainly bring on cataract. There's an indirect association with smoking and also ultraviolet radiation. Patients who have an outdoor job, they do tend to have cataracts more often than not at an earlier age. When do you see a doctor? Well, I would always say visit an ophthalmologist on an annual basis after the age of 40. Below the age of 40, if you have any medical conditions earlier. And when to see a doctor, if you see that there is a difference in your change of, if there's a drop in your vision, if there is a change in prescription of glasses quite regularly or quite quickly, your glasses prescriptions are changing every 3 to 6 months. if you're getting halos and glare around car headlights, if you need more light to study, if your colored shirts are lacking color, if your appreciation of the quality of vision has dropped, if you're finding it difficult to see, you go and see your ophthalmologist.